So could a fourth or fifth or sixth time be the charm? I've honestly lost count. I don't even know where we are. But that is essentially what has become the question when it comes to repealing and replacing Obamacare. But why now? Well, because Senate Republicans have put a repeal of Obamacare's individual mandate into their new tax bill to help pay for it. Does this help or hurt its chances? More importantly right now, what does this mean for you and health care in America right now? Joining me to discuss, Dr. Zeke Emanuel, CNN contributor and former health policy advisor to President Obama, and Lonnie Chen, who is the chief policy advisor to Mitt Romney. Great to see both of you.
Good to be with you.
Nice
Kate.
to be here.
So, Lonnie, let me go to you first. You wrote an op-ed in the Washington Post after the skinny repeal failed in the Senate. And in that you said the skinny repeal would have come nowhere close to solving the problems that plague our healthcare system. Why then is something of a skinny repeal now going to solve Republicans' tax reform problems?
Well, Kate, I don't think it does solve their problems, to be clear. I think the challenge is twofold. One, you've now mixed a very complicated issue with an even more complicated issue. So tax reform is very difficult. As you know, you've covered this closely, lots of moving parts. Now you've basically thrown a grenade into that process and made it even more difficult. The second problem, frankly, is it creates a political liability for Republicans, because by repealing the individual mandate, you make Obamacare's marketplaces less stable, you increase premiums, and you raise the possibility that people can argue that you're sabotaging Obamacare. So I don't think this is a great idea. I know that there's some reasoning behind it, but it's not exactly ideal at this point.
Doctor, it's one of the most unpopular parts of Obamacare.
Agreement here, because
I know
this
this segment just got lame because you guys are going to agree. No, I'm kidding. But no,
we got bipartisan agreement because this is a terrible idea, and I think, as Lonnie says, one of the worst aspects of it is it really doesn't address some of the issues, but it actually makes healthcare even more unaffordable. And I think if you look at a series of actions by this administration, which came in arguing for more affordability, they're going in the opposite direction. And let me just give you three. One, this repeal of the mandate would actually increase premiums, it's estimated, by 10% per year. That's not moving in the affordability direction, especially for individuals who have to buy it and don't have employers helping them. Second, there have been a series of moves under the radar, since we have had so much news, by the administrators of Medicare that have actually rolled back payment changes which we have seen good data are actually decreasing health care costs. They're rolling back those payment changes. That's not going to make health care more affordable in the long term. And then you have this nomination of Alex Azar to head the Department of Health and Human Services. It's the most peculiar nomination I can think of, in large part because he's a drug company executive, and he's going to stand against any attempt to roll back drug costs.
I mean, so he worked at HHS under George W. Bush.
More affordable. They're going in the opposite direction.
But let me get you real quick, Doctor, on this, though. The individual mandate is one of the most, if not the most unpopular part of Obamacare. When it comes to, they promised this, Republicans have for 7 years to repeal and replace. Is this the least bad of the bad options to get something done, though?
Well, if you're a Republican, you're facing the following situation. If we don't pass something, anything on taxes or health care going into the 2018 election, it's going to be a big problem. What have we done when we've controlled all three chambers of all three branches of the government? And I think that's their big dilemma. So they've decided to pass something, or try to pass something, which has no coherence. It's not good policy. There is almost no one who thinks this is good policy. Certainly responsible Republican health policy people do not think it addresses a problem in a coherent way. So I think they're just grasping for political savings, and they're not going to trying to do good policy to improve the healthcare system.
Lonnie, if this gets in the end, does it make it harder later to get a real comprehensive healthcare overhaul through?
Well, I think that's the concern that I have, Kate. I mean, it's possible that they repeal the individual mandate. It actually makes it more likely that Republicans have to return to health care in the spring and then have to get something done. That would be the optimal situation. But the problem is that you may have a lot of people saying, look, it was so difficult for Republicans to deal with Obamacare in the first place. Once they do the individual mandate, the appetite may not be there anymore. So it's tough to say. I will say, Kate, I disagree completely with Zeke on this issue of President Trump's nominee for the HHS secretary. I think Alex Azar is going to do a very good job and has wonderful experience to bring to it.
Let's continue the debate, non-debate, and then finally we got a debate a little bit later. Great to see you. Great to see you, Doctor. Great to see you, Lonnie.
Thank you.
Still
Take
ahead.
care.
Still ahead, accusations of sexual harassment on Capitol Hill, and you could be the one paying for it. Millions of dollars potentially paid out in settlements over alleged misconduct by lawmakers. How big is this problem? Why are we learning about it now?